Okay, welcome everyone to the public meeting of the Primary Care Commissioning Committee. Before we go any further, could I get any apologies for absence, please, for today's meeting?
We have apologies from Jeff Hurst, Dominic Slowey as members, and also apologies from John Costello and NHS England.
Thank you very much. We have met the quality requirements of half of the membership, including a director, a GP, a lay member. Yeah, there you go, and Bill. So good stuff. We're core and ready to go. So does anyone have any declarations of interest that they want to make about anything coming up on today's agenda? Okay, in that case, we'll just move on then to the minutes of the previous meeting on the 28th of June, sorry, 29th of June. Looking at those for accuracy, please. Does anyone have any points of accuracy on page 1? On page 2? And finally, page 3. In that case, we can record that as a true and accurate reflection of the meeting. There are no actions outstanding from the action log, pleased to report, which brings us in good time onto the workforce update. Jane, that's you. If you want to take it away, please.
Evening, everybody. Yes, I was asked by Dominic to bring a paper to discuss and to highlight the initiatives and opportunities and funding streams within the workforce agenda. I wrote the paper. It is quite lengthy because there's quite a lot going on with different things. I'm not proposing to go over everyone in detail, but just give you an overview of what we've been focusing on over the last little while. One of the biggest challenges we've got is capacity and how we share a lot of these funding streams, opportunities, initiatives, and understand what's happening on the ground with practices and PCNs in our area. So one of the things we've been working on with the primary care training hubs, which are now in existence in our area, is working on and trying to understand what's happening within practice and PCN world. We've now appointed 2 strategic leads within our 2 place-based systems, so they're getting hosted by our 2 federations to ensure they're linked directly in with the PCNs, and they've actually both now started in post in September, which has been fantastic capacity and quite a light relief for me to have some people within the place-based teams to have some conversations with. Their biggest remit and what we're asking them to do is work with practices and PCNs and help us to understand what the workforce strategy is for our area on a place-based level. This is for various, we need to understand what's happening at ground level to feed that up so we can help understand what goes on at local level to help influence regional and national initiatives. And we do that through the training hubs and other sort of regional footprints that are there for the workforce agenda. They're there and we're hoping to get them to work with us on informing what that workforce strategy looks like for, as I say, both Newcastle and Gateshead. They're looking at sort of key pressure areas, risk areas, strengths and weaknesses, training and development, career pathways, full use of the R's roles. So there's a big remit there, but it's working with them and ensure we're fitting into the system. Because the remit's so big, we're actually looking to potentially put in some funding with them for the 2021 primary care training hub monies, so we can add in some project support work in there. So these strategic leads will have some project support with them to ensure that they can take some of the agenda forward with practices and PCNs. We're also looking at a potentially GP clinical lead who will help support with some of the peer support sessions, support for clinical supervision, which is something that practices and PCNs have been telling us is quite a big thing for them now. We're bringing in lots of these R's roles, that somebody who can almost support the supervisors and a little bit of training around supporting how to do the strategy development with practices and PCNs. In the paper that was attached, there's a large number of initiatives, and as I say, I'm not proposing that I go through all of them, but there is a lot there. They come through from either from NHSE, from Health Education England, and they're from local, national, and regional schemes. So one of the biggest challenges is for us as a small team is to get practices and PCNs to be aware of the opportunities that are out there for them, and how we engage and get some momentum building with some of these programmes. To date, quite a few of them have been helping to design what those programmes look like, but we're now starting to get to a point where we're working with practices and PCNs to actually get people on programmes. So we've got a number of mentors going through the mentor programme. We're now starting to see some fellowships come through, so they're newly appointed GPs or GPNs in the area are now on the fellowship programme. We've got bids in for the post-CCT fellowship, which is the portfolio posts for those who have just recently qualified as GPs. We've got some GPs on the National GP Retention Scheme, which have been on the scheme for a number of years with the CCG, and we've got some local funding and proposals in for local retention schemes. There's some work started with around the flexible staff pools and how we use some small amounts of funding that have come down nationally to support some of the initial work that might help support some locum pools in the area. And we've had some great interest in the nurse leadership programme that came out last year. Around training development, we've got a number of we've ran a number of training needs analysis this year for various work streams and staff groups, which has enabled us to support, and we're now starting to put into practice some providers and some training programmes, which will either be run through TITO sessions where appropriate, so where we can run them through hour or 2 hour sessions. We'll do them through the time in, time out sessions, because we know that's a big help for practices because they've already got support for when they're closed. But there'll also be some opportunities for master classes and for module development within the nursing and allied health professional workforce. There is a number of opportunities within apprenticeships which continue. This is something we've been working with practices for a number of years now, and really starting to gain some momentum around practices coming to us to say, I've got a member of staff who is looking for the next development, and we're starting to use a lot of apprenticeships to build and do career development with internally, which has been a real benefit. And that's also in turn linking with the system around how we support levy transfers within the health and care system to support as many learners as we can getting through some apprenticeship programmes. We're working a lot with PCNs around the new R's roles, so the additional roles scheme that's coming through the DES, how we can maximise resource and how we use as much of that funding as available with them. There's been some various material set up and website now set up with which hosts lots of information around the new roles, around training education around the new roles, to help practices and PCNs understand what some of these roles can bring to them. And there's lots of work continuing to try and expose. We're trying to do a lot of things around work experience, but there's now T levels coming on board. We have to think about how we start working with those around placements and capacity to give exposure to our work areas, so that we can try and gain some students, and we know that if we expose people in the right way with a positive environment, they're more likely to come and want to work in those areas in the future. COVID has meant that some of our for example, our school leavers scheme, our placement scheme had to go on pause for a little while, and we're looking to sort of get that back up and running again to give some people some opportunities to work out in general practice on placements. And that's pretty much it in a nutshell. As I say, the paper does go into a lot of detail around some of the schemes that are there. So happy to answer any questions or any queries that people have.
That's great. Thank you very much, Jane. Does anyone have any questions or comments about the report or the paper? Jackie.
Just again to say thank you, Jane. There's massive amount of work there that you've done, and I do think we've got a good programme of support for general practice. And you're right, though, one of the difficulties is making sure primary care are aware. So I support any future investment that we can do into the feds to continue to enhance their teams.
I think my only reflection would be much the same. There's an awful lot of work there, but I suspect there's quite a lot of work in keeping your eye open for the right opportunity and knowing where to look, and having that support to do that is probably part of the answer, I suppose, or of a more streamlined way of doing things, because I wasn't aware there was so much out there. So thanks for pulling that together. Next, we have Neil with the risk register report.
Thanks, Oliver. I'll be brief because there's not much to report, and apologies to those people, governing body, who've heard some of this already, because it's a similar update report. So we bring the risk register to the committee quarterly. So Ros and Dominic and others review the risks ahead of we bringing it to the committee. This reporting period's been a quiet one. It was over the summer, and that's not to say lots of things haven't been happening, but the risk register has been quite quiet from a new risks or closed risks point of view. So the risks have been reviewed. There's no changes to the scoring or any of the risks on the risk register for the committee. There are 4 risks still on there. One thing that has changed is we've changed the policy around risks recently. So we've adopted a different way of a different matrices for scoring against the risks. So we now got a matrices which is red, amber, yellow and green, as opposed to red, amber and green. And that's brought us in line with, I guess, best practice. So NHS England have adopted this process, and we've aligned ourselves with that, along with the rest of the CCGs in the patch. So that'll help us in the step towards the ICS when we're looking to, I guess, consolidate risks and the process across the patch ahead of transferring to the ICS. So we're on a journey there. But what it does mean is that although the risks haven't been scored any differently, because the matrices is slightly different, some of the colours have changed. So I think 2 risks on the primary care risk register, the one around sustainability of primary care, it's scored 60, which was red in the old world. It's now amber high in the new matrices. And similarly, there's a risk around, I guess, the formal assurance around primary care commissioning arrangements. So have we got primary care committee and things like that in place, which was a low scored risk. It was rated green, but it's now rated yellow, although the scoring of the risk's still an 8. So that's a kind of one-off jump in colours, if you like, but not in the severity of the risk. It's just the peculiarity of adopting the new matrices. So that'll work its way through after this reporting period. It's just a one-off artificial change, really, just through adopting the new matrices. That's the main changes.
Thanks so much for that, Neil. Bill?
Should we have been recording this meeting?
I think it is, Bill. I think something's
Yes.
picking up in the
All
corner.
right. It just hasn't come up on my screen. It normally does.
Thanks for bringing that up, Bill. But I'm pretty sure I've got the sign up.
I was just trying to show I'm still awake.
I'll try not to take that personally, Bill.
It's don't worry, it's my chairing's done it.
As soon as it came out of the mouth, I realised, whoops, I'll take that back.
It's too late now. It's recorded. It's part of the handover.
I'll just get a glass of water to help my foot go down.
Georgina.
I'm just going to join you with a silly question on the risk scores, Neil. It's like 1 to 6 low, and then it goes 8 to 10 moderate. What is that? Because you can't score an uneven number, is that right?
Yeah. So
integrate. Is that right? So it only needs to be even numbers.
yeah. So that
it does go up to 25, which isn't obviously an even number. So just a bit puzzled about where it would sit if you scored. Well, like if you scored an 18 on your risk score, where does that?
Oh yes.
Georgina, it can't go up to prime numbers.
Okay.
Sorry, no, that may be incorrect. Sorry, I haven't looked at that, but yeah, it's a matrices, isn't it? So you get 1 to 5 both sides. So there would be a case where you'd get, well, would there be an 18? No, there wouldn't be. So
It wouldn't be. Okay, fair enough. So
Yeah.
that's fine. So that's why it doesn't all add up. It's not just me
That's
being.
yeah, it's a 5 by 5 matrices. Yeah. Sorry.
Sure, I'm sure it works. I just was looking at it, thinking, what if you score a 17 or an 18? Where'd you get in there?
Yeah.
Okay.
Yeah. No, you wouldn't.
Well, that's some advanced mathematics, which has flummoxed me. So thanks for that. That's Any other questions on the risk report? Okay, thanks very much, Neil, which brings us on to system development funding from Ros, please.
Okay, thanks, Oliver. I'll just take you through briefly some of the points in this paper. So I'm just going to talk to you about the primary care system development funding. It's some additional funding we get for PCNs and practices via NHS England. It concentrates on the area of workforce, digital, along with some practice resilience and PCN development funds. There is much more in the SDF sort of attachment that's on this paper, but there's certain areas, and there's just training hubs, online consultations, PCN development, practice resilience and COVID capacity that we need to feed back to NHS England as a plan to say how we're spending those pots of money. So that's what I've concentrated on in this paper. For the training hubs, obviously Jane's already given an update, and there's a detailed update within the paper that she's provided, so I won't go over training hubs again, other than it's sort of attached on the plan, and we'll feed that back to NHS England. The next area for online consultations, the CCG have actually got funding of £141,000 in 21-22. This is to be used sort of obviously for digital and online consultation areas. Mandy Mitchinson, who deals with sort of the digital side of things, has actually given us an update to say that this funding will actually be used to cover supplier costs for the online consultation solution for practices that's being used at the moment. I think the current contract actually runs out in October 2021, and we're just looking at one or more solutions to actually take that forward following the end of the contract that's in place. So that's kind of where that pot of money for the online consultations will be used. For the PCN development funding, we've got £257,000 for the CCG, and the guidance states that this needs to be used to support PCNs. It's about improving patient outcomes, working conditions for staff, enabling the PCN to play an important role in the ICS. There's quite a lot of detail in there, but in effect, sort of we hand out the money to PCNs, and as a PCN, the clinical directors and others within the PCN decide the best way to sort of use that money to come up with sort of ideas that are in the national deliverables that are there. So that's about recruiting, embedding and retaining new roles within the PCN, enhancing integrated working, and enhancing the understanding of links with the local population, which is quite a push for this year. So supporting a reduction in health inequalities. So that's where the allocation, we've received the first half of the year, which is 128,000, and we've actually allocated that to PCNs already. So what we would do is we will actually ask PCNs what they've used the funding on, and we report that back to NHS England in December. For the practice resilience funds have been around sort of for a number of years. This is kind of quite a relatively small amount because we're in the last year of this funding. As a total, we've got £66,000 for the year. Again, we've received the first half year funding. We've had a look at how this money can be used, because it is, as we say, for practice resilience. And I think with the issues at the moment being around access to GP practices, to appointments, what we're looking to do and what we're having conversations on is sort of promoting the use of an access lead within the primary care networks. So this funding, and because it is a relatively small pot of money, we will use some other pots of money that we're getting through access improvement schemes and any potential sort of underspend we have non-recurrently to actually fund an access lead to work across practices to look at various sort of issues within practice. It's to take part in sort of the survey that's part of the practice engagement programme. It's looking at the community pharmacy consultancy service to make sure that practices are signed up to that, to help with sort of, where the pharmacists can pick up some sorts of minor ailments on behalf of the practice. And there's sort of various streams that this links to. So that work will actually be passed out to primary care networks as well to fund that area. And I think the final thing we need to actually report back on is the COVID capacity expansion fund. So this has been some additional funding that's come through whilst COVID has been in place. We received some extra funding in 21-22, and we had this signed off at the private primary care committee. There is some sort of areas on there that are sort of priorities for the use of this money, but in effect it's to help practices sort of as we're coming out of the pandemic and to help them sort of increase GP numbers and capacity and continue to monitor the needs of the clinically extremely vulnerable, and so on. And it links to some of the learning disability work. That money's also actually gone out to primary care networks. That's based on waited list size, and they've received that in June 2021. So I think what we're doing is we're just reviewing these sort of pots of money as they're allocated to the CCG and just making sure we get them out so that the practices and PCNs can utilise them as soon as they come in. I think the only other thing that's on there is the appendix that just kind of summarises all of that, and that appendix will actually be shared with NHS England to say that that's where we're using the funds. Any of the pots of money that haven't yet gone out will get out as soon as possible, and happy to take any comments on anything on that paper.
Thanks so much, Ros. Jackie.
Okay.
Yeah, it would be interesting, Ros, to see whether there are any high-level system evaluation metrics on all that expenditure, really, in terms of what we've done for recipients of care. That would be quite good to see. I mean, it is about keeping the sector sustainable, and that's absolutely the golden thread through. But we're keeping the system sustainable in order to be able to respond to people's needs. And linking it across to the quality framework that we were discussing earlier, I think would be really good at some point.
Yeah, I think a lot of this is now interlinking sort of all the different pots of money we're getting, and some of the incentives we've got. We definitely need to keep a ring on it. And I think, you know, we're not always asked to give a lot of feedback to NHS England about what this is being used for. But I think as a CCG, we need to know what it's being used for and what sort of outcomes, patient outcomes, we're getting as a result of this funding.
Yeah, it's that strategic level stuff, isn't it? You know, we did A and we got B, and that's the journey we're taking primary care on. We're good.
Yeah, definitely.
Thanks for that, Jackie. Any other questions or comments? Okay, thank you very much. That brings us on to any other business. Does anyone have any other business for today's meeting? I'm not seeing any takers, which means that I can bring today's meeting to a close. Thank you very much, everyone. The next meeting will be on Tuesday, the 26th of October at 5 p.m. So I look forward to seeing you then, if not before. Thank you.
Thank you. Bye.
Take care, everyone.
Thanks, Oliver. Bye.
Bye-bye.
Thank you.
Thanks.